Well, I'm here at Hoosier Healthcare Occupational Health Services. This is Don Kiger on the right and Dr. Shoucair on the left. Gentlemen, you have this Hoosier Healthcare where people can see the doctor as often as possible for $25 a month. Tell me more about this. Who got this idea and really started this?
Well, it was an idea that we came up with for people who didn't have insurance, high catastrophic insurance coverage, high deductible, or someone who couldn't get into their family doctor. And we came up with this program to what we call Healthy Access, and Healthy Access for $25 a month allows you unlimited visits to any of our clinics. Once that you're inside our clinics and you have a procedure done, then we charge you at 50% of Medicare. So it's a way for people to be seen and have access to a practitioner and make sure that they have their medical problems taken care of.
Well, Medicare does not pay doctors and clinics and hospitals very much. And if you're able to provide services at only 50% of what Medicare would pay, then that's quite an accomplishment, isn't it?
It is. And how we're able to do that is that we are an occupational health clinic, and so we serve a large amount of our clients are businesses and industry. So our core business is in Occ Health. So we have economies of scale associated with being able to bill our workman's comp for our on-the-job injuries and physicals and DOT physicals and those type of things. So we have a good financial base. So all the infrastructure's here for occupational health. We have to have board certified practitioners. We have to have all the equipment you would need in an emergency room to be able to serve Occ Health. And by having all that, we're able, so our fixed cost is here. So the only thing we change is our variable cost when it comes to patient care. So we just see a few more bandages, another nurse practitioner, being able to see these clients on an ongoing basis. The only thing we change is our variable cost.
Well, how did you get started at this? How long have you been doing this?
I bought this company in April of 2009, and we put this model together right after I bought the company. I bought the company to put this model together. And then once we put the model together, we just started word of mouth advertising, and it's really grown quite rapidly.
And you've already started another location, haven't you?
Yes. When I bought the company, it really had one location. We're now at our third location, and we also have an exclusive arrangement with Fagan Pharmacies here in Northwest Indiana. And Fagan has discounted their pharmaceuticals drastically to accommodate this program. So you get a Healthy Access card from us, and when you walk into a Fagan Pharmacy, you show the Healthy Access card, and it gives you a significant discount.
It sounds like quite a deal. Let me ask you this. What would be a typical charge beyond the $25 per month? What would be a typical charge here compared to elsewhere, say for a PSA?
All right. Well, I can only speak from my own experience. Before I bought the company last November, I went in for a PSA at my local doctor, my primary care doctor. My insurance company didn't cover the PSA because they claimed it was a screening drug or screening test. And so they sent me a bill for $228 after my $30 copay. We do PSAs for $35 here. When I went to my primary care doc, it was over $250 for that same PSA.
So this is quite a business model to help people to get health care at reduced costs.
Absolutely. And not only get health care, but you get a high level of care because all of our practitioners are trained in occupational health. So board certified, highly trained individuals that have a broad spectrum from anywhere from urgent care all the way out to primary care. So that's kind of our business model is occupational health, wellness, urgent care, and primary care in one. And I challenge you to find another model like that, not only in Northwest Indiana, but anywhere else besides maybe a Kaiser Permanente No one else has this all-inclusive model in the marketplace today.
Okay. Dr. Shoucair,
Yes.
could you tell me a little bit about this clinic and what you think of it compared to other medical practice?
Sure, that's a great question. Well, in my experience, you usually have either a primary care practice or an urgent care practice or an occupational health practice. In my experience, I've never seen any institution that incorporates all three. In our case, we're actually incorporating 4 different models, as Mr. Kiger mentioned: wellness, occupational health, urgent care, and primary care. What's nice about this model here, we're basically one-shop stop. We can do everything here shy of major surgery. You come in the front door, we can take care of x-rays, we can take care of EKGs, pulmonary function testing, audiograms, physical exams, pediatrics, wellness, men's health, women's health. Basically the whole gamut is covered here. We have our own lab, we do our own x-rays like I mentioned. There's really very little we can't do. And I have a direct relationship with anyone who I have to refer someone out to. If someone needs to see a general surgeon or an orthopedic surgeon or any of the other specialties, I have a direct relationship with those providers who understand how important it is to keep costs down, but also at the same time give a high level of service and quality care to people.
Well, how does this compare to other practices, like doctors having other practices? Why are other doctors and clinics having to charge so much more? Like, for instance, Mr. Kiger mentioned about the difference between a $35 PSA test done here and a $250 PSA test done at his doctor's office earlier this year.
Well, we can speak from our own experience. I don't want to say anything negative about anybody else or any other practices out there. I can say from our experience and the labs that we contract with or any other vendors we contract with, we're able to keep the costs very low. I can't really address why someone is charging so much more than we are, other than, well, perhaps, Don, would you like to comment on that?
Is there something about you don't take insurance?
That's correct.
And you don't deal with Medicare or Medicaid?
No.
So a lot of paperwork is cut out. And is that where the savings is? Is it?
I believe so. I believe where we cut the middleman out, the bureaucracy is where we know what our fixed costs are. We know what our cost structure is. We deal with the same laboratory that my doctor dealt with, so I know what my cost is for a PSA, and I know what his cost is for a PSA. The only thing that I could think of has got to be in the bureaucracy, the backside, the amount of effort it takes to be able to collect for insurances or Medicare, Medicaid. We all know that bureaucracy slows the process, complicates the process, and adds a lot of layering for cost perspective into any of these type of functions.
Dr. Shoucair, you practice at other places too. Would you say that cutting out a lot of paperwork with insurance companies, Medicare or Medicaid, would be significant in cost savings?
Absolutely, and I have to say Mr. Kiger said that very well. That's an important point here. The only insurance that we do take is workers' compensation insurance, because again, we are an occupational health clinic and we do take workers' compensation insurance. However, other than that, we don't take any insurance. And we can pass on the cost savings to the individual this way. For healthy access, like Mr. Kiger mentioned, $25 a month, unlimited visits. If you want to come in Monday through Friday, every day for that month, it's still covered under $25. By cutting out the insurance, the middleman, we're able to pass on that savings directly to our patients and to the people that we're servicing. We have a one-on-one relationship. We don't need a third party getting involved. We don't need anybody else muddying the waters. We'll basically take care of you and we'll pass on that savings to you.
Thank you, gentlemen.
You're welcome. Thank you.